The government has lowered the age requirement for COVID-19 booster shots, shifting the eligibility in Guyana from persons 50 years and older and adults with comorbidities to all adults. Those vulnerable groups were prioritized for their booster to top up their immunity to the virus. Now, any fully vaccinated adult who was administered a 2-dose regimen can turn up to the various vaccination sites 6 months after their second dose for the booster jab. This was revealed during the daily COVID update by the Health Minister, Dr. Frank Anthony.
So as of today, we would be opening up booster doses for anyone 18 years and older. You would now be able to get a booster dose. So those previous requirements that we've had where you have to be 50 years and older, we have now lowered that requirement.
To date, 2,774 booster shots have been administered. Just 3 days ago, that figure was 1,914. This means that in the span of 72 hours, 860 more persons turned up to the Ministry of Health's vaccination sites for the booster jab. Following its rollout 2 weeks ago, the program has been seeing a seemingly favorable response. Providing a breakdown of Guyana's vaccination campaign, Minister Anthony said that 738,995 doses have been administered so far. This includes first, second, and booster doses. 403,537 or 78.7% of the adult population have taken the first dose, while 282,567 or 55.1% are fully immunized. Turning to the 12 to 17 vaccine program, the minister said that 20,659 or 28.3% of that population have taken both doses, while 29,458 or 40.4% have just administered the first jab. He reiterated the call for Guyanese to grasp the opportunity to get vaccinated and cautioned persons not to let their guard down during this festive season.
We have to be careful, however, as we go forward during the holiday season with how we interact with each other, because we still have a lot of active cases. 1,018 is still a lot of active cases.
The Minister of Health also revealed that COVID-19 has claimed the lives of 10 children, including adolescents locally. Dr. Anthony said that the common denominator in the children's deaths were their underlying medical conditions. This, coupled with pneumonia brought on by the COVID disease, resulted in breathing difficulty, which exacerbated the situation.
We have had 7 males, 3 females, and in terms of age, children less than 1 year. We've had 3 children who were less than 1 year that passed away from COVID. We had a 4-year-old, a 5-year-old, 11-year-old, a 16-year-old, and a 17-year-old that passed away.
Meanwhile, Guyana was scheduled to receive a quantity of vaccines from COVAX on Monday afternoon at the Chadijagan International Airport. In a previous COVID update, Dr. Anthony said the shipment would include more jabs of Pfizer, AstraZeneca, and the Johnson & Johnson vaccines. For the HGP Nightly News, Amel Griffith.